She's an ophthalmologist and a refractive surgeon, but more than that, she is now my mentor in mindfulness, and I think instead of she herself will now start a session. And she did a wonderful session with our staff, because now I'm making a new organization in the sense to serve poor people. So I want them to have the same vision and mission, what I have in my mind, to give it to my staff. Thank you, Krupali.
Thank you, sir. So at the outset, I would like to thank Dr. Natarajan, sir, AIOC, and Dr. Evo for giving me this opportunity. So how many of you have ever felt stressed, exhausted, or burnt out in your medical career? Show me with a raise of your hands, please. Thank you. Thank you for your honesty. Thank you, sir. You're not alone. Over 50% of doctors in the medical profession, they go through burnout. And yet, we are taught to just push through. But what if I tell you that a simple change in the mindset and mindfulness can help you release this stress? How many of you have ever thought or questioned that why, being a medicos, we are never taught how to handle stress in the medical schools? Show me with a raise of your hands, please. Thank you, sir. Thank you. Thank you. Did you know that studies show that over more than 60% of doctors, they go through emotional exhaustion? And yet, we continue working in stress, you know, just thinking that it's a part of our job. Yes. So first of all, let me tell you, thank you. At this point of time, you could be attending any of the sessions in various halls, but you still chose to be here. That really means a lot. So thank you once again. And let me also acknowledge the reason why you are here is somewhere deep within, you believe that there is a leader within which needs to be awakened. And that's why you are here. So we are going to spend the next few minutes together. So is it okay? Can I share something that who am I and why I am doing this? Is it okay? Can I have your permission? Yes, thank you. A few years ago, I found myself completely drained, both physically and mentally. I was constantly exhausted, having sleepless nights, and my passion for my work was fading. I thought that this is just a normal life of a doctor, until one day I hit the breaking point. And I realized that no amount of external stress or external changes, that is more coffee or more vacations or reducing my workload, could fix the deeper issue within. The real problem wasn't just the system. It was within me. And that's when I discovered the science behind mindset and mindfulness and how it can reduce stress. And I started studying about mindset and mindfulness because I was in soup. And I learned that stress isn't just caused by the external situations, but how our brain processes them. And the best part was that we can rewire our brain, and thus without sacrificing our happiness. And because of that, I started seeing changes in myself. I was calmer during the stressful patient encounters, more present in my life, and I rediscovered the joy of giving vision to people. And because of that, I realized that this wasn't just about me. When I was less stressed, my patients felt it. My colleagues noticed it. And I started sharing these techniques to doctors who began experiencing the same transformation. So this wasn't just a theory, but it was a game changer for medical professionals worldwide. Over the period of 2 years, after helping hundreds of people live a and life and not an or life, I am here, Dr. Krupali, a cataract and a refractive surgeon practicing in Mumbai, and a mindset and a mindfulness coach on a mission to help 100,000 people to live a happier and a fulfilling life. My heart couldn't settle for less, because I recently saw that, there were many doctors committing suicide. I was just speaking to Dr. Natarajan sir about a young chap who had 200 PubMed publications, a dermatologist, but he recently committed a suicide. Yesterday, I saw news that a girl pursuing DM and on the verge of giving entrance, but she gave up on her life because she could not handle stress. And that's when I spoke to my mentor, Blair Singer, that, Blair, how can I manage both my professions? Both are my babies. I love giving vision to people, and I help people live happily. He said, Krupali, you know what is greed? He said, greed is having a gift and not sharing it with the world. So that's when he connected me deeper with my purpose and my calling, that Krupali, just go for it. And as Dr. Natarajan sir just rightly pointed out, as what Paul Coelho said, that when you desire something, the entire universe conspires you to give it. So let me ask you one question. How many of you have kids, or you have been around kids? Show me with a raise of your hands. Thank you. So how many of you know that who wins when the kid is at the highest energy? Who wins? It's either you or the kids. Kids, right? Thank you. You know why? Because it is said that highest energy wins. Highest energy wins. So just imagine if I'm here and I'm talking, hi, my name is Dr. Krupali, and I'm going to talk about mindset, and there are 50 slides and 20 pointers each. You would just run away, right? Because that's too boring. And that's when, how many of you would require, would desire to have more success and happiness in your life? Show me with a raise of your hands. Thank you. How many of you desire to earn a lot of money? Thank you. And you know what these things require? They require energy. So learning requires energy. Learning requires what? Energy, yes. Thank you. So I'm going to talk to you about how mindset and mindfulness can help you reduce your stress. Let me tell you, this is a scientifically proven and evidence-based science. But there is one problem. This model is fail-proof, but it has one problem. This organ over here, brain. So let me ask you one question over here. What percentage of decisions do you take consciously? Can you just shout out, please? Yes, consciously. What percentage of decisions do you take? How much, sir? 80%. Sir, I'm sorry to tell you, and you will be disappointed to know this, that only 10% of your decisions you take consciously. So what is it about the remaining 90%? The remaining 90% is your subconscious mind. It has all your thoughts, your patterns, your beliefs, which you have acquired from your parents, from societies, from teachers, and from media. But, this subconscious mind has one characteristic. It has a little voice. The little voice which says, I am not good enough. I cannot do this. Or I am not worthy. Or I am not ready. How many of you have ever had such small little voices which stops you from preventing the next goals? Thank you, ma'am, for your honesty. So is it okay if I share you some tip that how to lower this, the little voice which stops us? Is it okay if I share you? Yes, thank you. So how many of you here watch some kind of sports? Thank you. And so what do players do when they win? They celebrate, right? They celebrate with high fives, they hug each other, they lift each other's, right? So it is said that when you celebrate your wins, even if it is the smallest of the wins, you lower this little voice which is stopping you from achieving success, right? So with this, I would just like you to turn around to some person next to you. I know there are many empty chairs, but turn around, just give them a high five, and just remind them that celebrate your wins. Thank you, thank you. But this is not a normal, talk. What I would like to request you all is to be 100% active and participate. and stay till the end, because at the end, we are going to do a beautiful mindfulness practice, and you can experience the magic. And can I share you one difference, which is there between a highly successful and a fulfilling person and a person who is unsuccessful? Is it okay? Yes, thank you. So, really a successful person, he takes 100% responsibility of their actions. For them, there is no blame, there is no excuses, and there is no denial. They take 100% responsibility of their actions. So as you have agreed that you would participate 100%, so what I would like you all to do is, these are the different areas of your life. So just rate yourself, even in your mind or maybe in your notes in your phone, that how much would you rate yourself, with 1 being the least and 10 being the highest? In career, money, family, health, spirituality, and relationships. Could you all please note down? Thank you, ma'am. Thank you. Yes? So with this, what I would like to show you is that this is a wheel of life. So just imagine that if a person is highly successful in his career, in his money, but his physical and mental and emotional health is at toll, what would happen? He wouldn't be able to live and enjoy his life completely. And on the other hand, if the person is extremely fit, but his finances are haywire, he would still be unhappy, right? And so I would request you all to, that after every quarter of your life, after every 3 months, just go and visit that which area of my life needs more attention right now, because the wheel has to be balanced to live a happy and a fulfilling life. In healthcare, the burnout and stress are at an all-time high. And 50% of the doctors suffer with burnout, and which leads to poor patient care, medical errors, and dissatisfaction. So let us see what WHO defines burnout as. It's nothing but a physical and a mental exhaustion where one becomes cynical, negative due to chronic stress. So these are the various stages of burnout, where eventually the patient at the 12th stage just may collapse or have a physical or a mental breakdown. Now let us see what is stress. Stress is nothing but an autonomic nervous system response activating your fight and flight response. And this chronic stress, it increases the cortisol, the adrenaline levels. It impairs the prefrontal cortex, which is the cognitive area where the thinking happens, and it weakens the immune system. So let us see that, as a men and females, what all roles do we play in our life, right? The men over here, we play a role of either entrepreneur, employer, employee, father, son, husband. And female friends over here, either way, you play a role of mother, wife, daughter, daughter-in-law, apart from being a doctor, right? So there are many areas which causes us burnt out. Yes, sir, son-in-law. True. Thank you, sir. So let us just see that what are your biggest stressors at work? How many of you think that you have long working hours at work which leads to stress? Can you please show me with a raise of your hands? Thank you, ma'am. Thank you. How many of you have or have experienced toxic work environment and hierarchical pressures? Thank you. Thank you. And despite of working hard enough, you've never got that support or recognition. How many of you relate with this? Thank you, ma'am. Thank you. Or how many of you have felt that you are sleep deprived? Thank you. And lack of work-life balance? Thank you. Thank you. So the solution here is mindset and mindfulness. So let us see what the scientific evidence behind mindset says. A study in JAMA in 2021 found that physicians who experienced or who went through mindfulness reduced their burnout by 30%. And Harvard Medical Study shows that a positive mindset enhances resilience and cognitive flexibility, thus reducing stress. So what is mindset shifting? Okay, our brain has a unique capacity of neuroplasticity. Our brain rewires itself based on the repeated thoughts and behaviors. So, you know, like our senior professors would agree that few years back we had studied that neurons, you know, they don't develop, or this concept of neuroplasticity was not there when maybe Dr. Natarajan sir, Dr. Evo and Dr. Kumar would have studied their MBBS, right? But now the scientists have found that the brain has a unique capacity of neuroplasticity. The negative thought patterns, they create a certain neural pathways which reinforces stress. But a wonderful study by Carol Dweck suggests that when you shift from a fixed mindset to a growth mindset, it enhances your problem solving and emotional regulation. So, some of the few practical strategies which I would like to share with you are, first of all, is cognitive reframing. You know, our words have a lot of power. Whatever you say after I am becomes reality. So be very, very mindful that what are you saying to your own self. If you find yourself or your loved ones constantly saying that I am exhausted, I am tired. You know, the stress has become that new trend, like Ghibli trend, which is coming right now, right? The similar way, every other person you meet and they say, I'm stressed. And what are they inviting? They're inviting more stress, right? So just reframing your words that I am exhausted to this is a challenge and I am learning to navigate it. Just think, it's more empowering, right? So anything what you say after I am becomes the reality. So if you don't take anything from this talk, I would just like you to go with this one thought, that be very, very mindful. What are you saying after I am? Second one is gratitude. Gratitude is nothing but being thankful for what we have. It is wonderfully said that gratitude and dissatisfaction cannot coexist. You can be either dissatisfied in life, that is unpeaceful, or you can be grateful and peaceful. So a research from UC Berkeley shows that gratitude improves your mental health by activating the happy hormones, that is dopamine and serotonin. So let me ask, what was your first thought when you got up today this morning? There are many people who didn't see this morning, and yet we take our life for granted. We don't know from where the next molecule of oxygen which we are breathing, but it is freely available. We don't know, so many friends over here have left their kids and their spouses at home, including me, and they are taking care of the family there, and I am here, but we forget to thank our loved ones. We forget to give thanks to what we already have. So it is beautifully said that when you keep counting your blessings, or when you are grateful for what you have, you get more things to be grateful for. So can I have a moment over here? And just each one of you, just close your eyes and just count your blessings. Just think of any 5 things, person, or situation that you are really grateful for. And you're counting your blessings, so I think a smile on your face would be wonderful. Thank you, Dr. Prasanna. Thank you, Dr. Evo. Thank you, sir. Yes, thank you. And the third is that when you shift your words, how many of you think that every day you have, I have to-do list, right? I have to cook, I have to send my kids to school, I have to make their tiffins, I have to go to my clinic, right? But what if instead you shift your I have to I choose to. I choose to go to work. I choose to make my kids tiffin. I choose to, it just soothes your parasympathetic nervous system. So just by a simple shift in words, you can rewire your brain into less stress and more positivity. So take one moment here and write down or just note it down that what is one belief that you want to let go of today? Do you want to let go that I am constantly stressed or I don't have enough time? And reframe it to a positive, empowering one. The next strategy is mindfulness. So what does mindfulness mean? It just simply means that staying in the present moment. And as Dr. Natarajan sir beautifully said, that when you think about your past or about your future, you are not living the present moment, which is the real gift. So mindfulness simply means to stay in the present moment. So how does this mindfulness reduces stress? It lowers your amygdala activity, which is nothing but your emotional brain, which reduces fear and stress response. It strengthens your prefrontal cortex, and thus you are able to take better decisions and you're more focused. And it increases gray matter density, which improves your cognitive function and emotional regulation. So again, a 2016 study by JAMA showed that a mindfulness meditation, it reduces stress by 38% in the healthcare workers. And they also did an MRI scans about there was two group of people, and they found that one cohort which underwent 8 weeks of mindfulness practices increased their brain density in areas linked to emotional regulation. So here are the few mindfulness techniques. First one is the breath work. Mindfulness simply meant that you live in the present moment, right? So the first one is the breath work, wherein you do a box breathing. You inhale for the count of 4, you hold for the count of 4, you exhale for the count of 4, and you hold for the count of 4. So is it okay? Can we all practice just one box breathing right now? Right? Thank you. So just inhale at the count of 4. Inhale, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. And hold on for 4. Thank you. This technique does not require you to be in a very, you can practice this in anywhere, even in your busy hospital or at your workplace or at your home, right? The second one is meditation, which is nothing but focusing on your breath. Even this, because what these mindfulness practices does it stimulates your vagus nerve, and so your heart rate lowers down, and it gives a signal to your brain that you are safe and everything is fine. The third one is a grounding technique, wherein wherever you find yourself stressed or constantly the thoughts are running out in your mind, what do is you identify 5 things that you see, 4 things that you feel, 3 things that you hear, 2 things that you can smell, and 1 which you can taste. And the last one is nothing but taking mindful micro pauses, nothing but of 60 seconds, and focusing on your breath and bodily sensations. So can we all just relax, keep your phones and everything aside, and just close your eyes. Sound, please. Just relax and close your eyes. And take a deep breath in and breathe out. And slowly, as you breathe in and relax, feel your body and your mind completely getting relaxed. And continue taking deep breaths. And just bring to your mind 3 things that you are really grateful for. And slowly, whenever you are comfortable, open your eyes with a smile. How was it? Thank you, sir. How about you? Thank you. So, you know what I would like to conclude here is that we are taught to prioritize patience over ourselves. And stress, as we know, it is inevitable, but suffering is optional. A small shift in the mindset can make a huge difference. And mindset and mindfulness, these are scientifically proven to reduce your stress and enhance your cognitive function. And mindfulness is not just about sitting in long hours for meditation. It is just about being fully present, even in a busy hospital or at home. As I just told that, we spend our entire lives healing others. But let's start by healing ourselves. And we are taught to prioritize our patients over ourselves. But how can we heal others if we are running on empty? So I would like to request you all to practice any of this one mindfulness technique for a week and just observe what changes are you noticing. And as Anne Lamott beautifully says that, almost everything will work again if you unplug it for a few minutes, including you. What happens when our phone just gets hanged? We put off all the apps, right? And we shut it out for a few minutes. And the same is with our brain, which has so many tabs opened up at one particular point of time. And with mindfulness, by being present in one moment, we are just reducing that stress. And even your own self will find yourself better when you just unplug it for a few minutes. These are some people, who speak a lot about mindset and mindfulness, that how their life has changed. And Jack Canfield has beautifully said that it's the event. So E is events, R is response, and O is the outcome. The outcome that we experience in our life depends upon the response to the events and not to the events itself. The events can be the same, but it's always your response to the events determines the outcome. So this is one of the pick with all my mentors who has trained me for mindset and mindfulness. And last week, sir, last Tuesday we did, right, sir? Yeah, so last week I had an opportunity to do a session on mindset in Aditya Jyot Hospital for Dr. Natarajan sir's team. I had no plans of doing this session. I was not registered also. But sir said that, Krupali, you have to come because you can empower so many young people who are going through stress. So my journey in this mindset and mindfulness began 2 to 3 years back when I was at my lowest low, and that happened when I lost my father. When I was questioning, God, why am I here? What more in life? And that's when the mindset and the mindfulness coach emerged. So that's all from my end. Thank you, Dr. Natarajan sir, Dr. Evo, for giving me this opportunity. And thank you, AIOS.